In cases of neck pain, acute neck pain, chronic neck pain, we also find that the combination of the TCare with the Mi.TO table is very useful because we can again combine movement with a more passive treatment. So what we're going to do here when we have a problem with the neck area, then we can place either the passive plate under the belly, even under the chest. There is no contraindication for that, although I prefer to place it under the belly. It's more comfortable, particularly for the ladies. We would always start with a capacitive mode warm-up, but then very quickly move to the resistive mode, and passively we could work on the trapezius muscles, maybe the levator scapulae. We could also work on the rhomboideae muscles, the suboccipital muscles, and then when we're ready, we can introduce some movement. By simply moving the head section. If we want to add some rotation, we can ask our patient to look maybe towards left or right. We place it here, can move a little bit, and we can work here. It's very nice and gentle movements, very smooth movements that we can make. I even find that this treatment works very well for patients with temporomandibular joint disorders. Temporomandibular joint disorders frequently have an element of problems in the cervical spine, and therefore I usually also combine therapy for the neck in temporomandibular work. And for the temporomandibular work, we use the smaller handpiece. We reduce a little bit the energy settings. Yep, and you can turn around. Yeah, and we can simply work on the temporomandibular joint here using our movements, but also combining mouth opening and closing. And we can move over the masseter. So really this combination of two devices gives us a lot of opportunities to treat our patients more efficiently and more effectively.